just to make sure we're still aligned for today's group?
Yeah, sure. So I think I would like it if first you would share maybe the first couple things that come to mind for this. What typical supervisors or program managers would do and tools they would utilize in the cloud. And then I would like it for our team if he doesn't say something that you think would be helpful, please feel free to speak up and ask him if it exists, and if it does, how to do it.
Sounds good. Okay. So I'm going to take you through, excuse me, I'm going to take you through common things that you might get reported to you on the first couple days of Go Live. And generally, it's people forgetting their passwords, can't log in. Why is a client not on the dispensing board? We brought 5 clients live yesterday, so I have a very thorough list of the little things that day-to-day staff users do that they'll generally go to their supervisors with that really are just user functions. So I'm going to start with that so you're prepared that what's going to happen on day one when your staff goes to the cloud. And then I'm going to show you what things to look at, what things to oversee all of your staff. That includes, looking at your staff's encounters and grouping encounters for time frames, and how do I look at treatment plans, and how do I look at staff work that they're doing. So I'm going to go through those things first, just to kind of prepare your team for what should I be looking at or what should I expect the first couple days. And then I'll let you guys ask whatever things are important to each of you, and we'll just go through it. So these are really your sessions, and you guys can ask me anything. So I know I say this a lot in the training, but generally the first thing that's going to happen is you're going to get 5 to 6 people out of your whole organization that say, I can't log in, it says no practice code found. Anytime you get that email, it means what they did is they bookmarked this blue page. They're like, ooh, I'm going to cheat the system, and I'm going to bookmark this so I can get into the application faster every day. Anytime a client calls you and says, no practice code found, can't log in, no username and password, generally all you have to tell them, just close your application altogether, double-click it, reopen, and hit your yellow button. 99% of your problems are going to go away. That's the most common thing as a supervisor that I get reported on day one is someone said their passcode doesn't work. Generally, that's the first thing we troubleshoot and just tell them to close out and start over. Okay? Now, as a supervisor, I'm just going to log in. There's 2 or 3 main things that I tell clients to look at the first week of Go Live, and that is staff signing encounters, okay? So on the left-hand side, the My Encounters tab is super important. The My Encounters tab for a supervisor allows you to take any employee, look at all their encounters, and what they're doing with their work, okay? So you can select all your staff users, say, show me all their work. I want to see is everybody completing their documentation. Okay, now I'm just going to add Henry in just so I get some notes in here because that's my test user. I also could sort by types of encounters, or I just want to see what these people are doing that's signed or unsigned or certain statuses. So as a supervisor, I just might want to see my program's unsigned notes. I want to see is 90% of the work of all my staff being signed, completed, and billed within 7 days. So you can look at what's sitting in a bucket at any time for your whole department. Okay, so this is pretty important. If you hit the search bar, okay, I'm just going to go back and change my date range because I didn't do any notes today. I have 1 unsigned encounter for this provider and for this patient. So if you look a month into this and go, well, I have 1 unsigned encounter for all my staff, you're doing amazing, okay? If you want to quickly look at documents or look at a patient that you may have a problem with, and you want to see who the staff user is, you want to see what notes have been done, the best audit tool for a supervisor, the My Encounters, is if you want to look at the work that's being done by staff, whether it's signed, unsigned, amended, you just want to see the work over time of any of your staff, go to My Encounters, group those clinicians together or pick one, and just look at their caseload, the work they're doing, and are they signing things, not signing them, are they leaving them open for a month? That's the first thing I always want a supervisor to look at the first week, because we can make corrective actions earlier. Once people get into habits, we all know it's harder to change. I think this is a very important thing for the supervisors. Keep your staff getting their work done so they don't get backlogged. Okay, that's the first thing. The second thing is, that's at a employee level. What's the work that they're doing? What encounters did they do? Are they doing everything correctly? At the patient level, if you have an issue with a client, generally what I tell supervisors is if you have to review any specific clients, and I know we went through this in training extensively, the first thing you want to do is go to patient programs. Patient programs will allow you to take any client, and you can just search their name up here. Click on their little silhouette. And without having to go into their chart, the timeline is going to show you everything that happened. So I'm going to show you how I use this. The timeline's nice at a patient level for supervisors to do reviews and audits and check on what's been done. There's one little trick that some staff members forget, that when it loads the timeline of everything that recently happened, it generally only pulls a certain amount of data. So it's usually about 10 to 15 lines of the 15 most recent things that happen. If you hit the All button, okay, it'll expand out and show you the whole patient's stay. So a lot of times supervisors will call me the first week and say, well, they only have 3 notes, and I know we did 50 progress notes and the system lost them, and that's not generally the case. It's that we're trying to do things quickly in the application, so we don't want to delay something opening by having to always grab the whole chart. Just remember the All button. So once you have the All button, this is where the timeline really is nice. You can filter the timeline, and I'm going to show you why this is nice compared to the other way to do it. You can filter the timeline to say, well, I don't care when they were admitted into the bed. I don't want to see that we booked 40 appointments. I just want to see their clinical work. You can change this and say, get rid of everything else, just show me the encounters. So what it did is it took out like 80 different events that happened, and it's just the clinical work that was done. And then from there, you can even go further and say, just show me all the group notes, or just show me all of this. So you can filter through this if you're trying to investigate or look at something or some events that happened with a client. The timeline we find supervisors at a patient level are using all day long. On the timeline, everyone should know this by now, just double click. You can review each encounter. You can go through a bunch of them. Just double click the orange or green. But this timeline also tells me something else. It tells me there's a lot of unsigned encounters, like My Encounters was at the patient level. I wouldn't like this if I saw 50 unsigned encounters in a patient's chart that's been here for 3 months. This would tell me people aren't completing their work, kind of like My Encounters does. But this is just for this patient. So that's the first thing I would look at, My Encounters and patient timeline. Now, the next thing that comes up a lot of times at a patient level or a consumer or client level is I want to see their admission history, like what happened over time, how many times were they here. So if you click the little Admit Discharge button at the top and select Show Me Full View, it shows you when they were admitted, how many days they were here, when they were transferred to a program. This seems to be a hot tool in our new system. Everybody seems to say that they love it. The key is, I'm just going to show you how to use the timeline, okay, from a supervisory role. Does anybody have any questions about the timeline?
People can't show up. I had one company call me for a month.
Okay. Next thing that we have over here is, as a supervisor, generally I'll ask supervisors to check group notes. So if you have groups and you're responsible for a program that has groups, go in and periodically check your groups. We see a lot of times that lower level staff, therapists, interns might be creating the encounters, that group notes don't get signed when they should. You might not have that problem, but we see it a lot. So in here, the staff user who's doing groups generally is only going to look at the week. Like, I just want to see what I've done for the week. But as a supervisor, you might want to go in, and I think I have a couple of test groups in here. Okay. You might want to go in and say, show me everything that was done for the group over time. So you can change your dates, and if you want to see this group and its activity and who came in and who came out over the past 6 months, you can change the date ranges up here as a supervisor to say, show me the history of the group. So this section here will show you everything that's happened over a longer period of time. So if you change the date range and show me for a month, it's going to look something like this. So I'll just add a group now, and then I'll add a group from last month, and then I'll add a group from 2 months ago. Okay, so I'm not going to check all these, just so how you look at it. So if I come in and I want to look at a group over time as a supervisor, this is always going to default just for the week, okay, for anybody who logs in. So for the week of October 1st, let's do October 1st through tomorrow. Let's hit search. I have no groups. But if I want to look historically of how we're doing with this group and total number of patients and things like that, I might want to say, well, let's go back and historically look at the group and how many of these groups we have. So now, then what you'll see is you'll see the whole group. Now, I didn't start all those, so it doesn't show you, but what it's going to do is it's going to show you the whole history of the group. Supervisors, the first couple months, they're going to want to watch their groups to see that all notes are being signed, all groups are being billed, and so forth. So in the group therapy module, looking at the bigger picture in a group generally is important. Okay? All right, anybody have any questions about using the timeline, going through my encounters, and looking at groups over time? Okay.
Jim, if I could interrupt for a second. I know that some of us have to go to another meeting at 10. Do any of you have any questions or anything you specifically would like to see from this?
It seems really similar to the My Encounters option we have in our current system, it sounds like. And then I guess I just wanted to clarify, Jim, most of my staff, and I think for other staff to get emailed through the system for approvals, and that will just be the same as our current system, correct?
Yeah, so the way that it works, let me just show you quickly to make sure it's the same thing that you're asking. So let's use Z Patrick for an example. I always start in patient programs. It's just an easy way to get everybody using the same part of the system to kind of start their day. So I'm going to go into Mark. I'm just going to pick any type of assessment that needs approval. So I'm going to click the All tab. I'm going to click the biopsychosocial. Let's do a new one. It's going to ask, is this you as the provider? Yes. So I'll clean up my screen as well. So maybe I'm not a good user, so I just want the whole screen to be able to see. Just going to type through. You can scroll down and answer them. You can open up, jump from section to section. Okay? So just navigating through. You can do legal history. And then when you're done, if someone's routing work for you for approval or a second signature, not including a document, this is actually an encounter that needs approval, they click the signatures button. And the signature button allows the clinician who did the encounter to sign it, okay? So let's say I'm the counselor and I'm going to sign the note. So I'll say I signed it. But I also need to route it to you. So what I'm going to do is pick the next level, and I'll send it to Henry, just because that's me, even though I'm the one signing, but just so you see what happens. If you hit the little button here, it's going to take this encounter, and it's automatically going to route it to your pending documents. So you'll see, or I'm sorry, pending signatures. So if it needs multiple approvals within an encounter, the staff should be using the signatures button. You guys may have used email, possibly, which you can do, but I think we showed most of the staff to use the signatures button because it has the auto routing already built into it. Is that what you were looking for?
Yep, that's great.
Okay, but let me show you where that goes, because you are going to find you have supervisors that maybe, or who's ever signing off, that's not great in the system the first week, right? We all know that it's a new system. Some people are going to struggle more than others. So where this went, when I hit this little button up here, okay, and I'm just going to transfer my signature into the encounter, and I sent it to myself, right, just so we could see what's happening.
Mm-hmm.
So when I come in the morning and I open up, I always tell everybody, check your inbox to see what work was sent to you. So it's in the inbox. It's the message system. And if you look down here under pending signatures, do you see a 1? That's because I just routed myself, in this example, a biopsychosocial to review and approve. So if I click that, okay, I should have a pending signature that came from Henry 7. And if I just click on it, it linked Mark Patrick. I can open it. I can review it. And I can add a second signature. Now mine's already on here because I sent it to myself, but that's the workflow. So you do the encounter, you hit signatures, it goes to the inbox of the supervisor, staff supervisor. They open it up, they read it, approve it, or send it back. Is that what you were looking for?
Yes, thank you.
You're welcome. Okay. What else? Let me just say one other thing too, just because I don't know if everyone covered it. It's pretty important. But when you're uploading documents that need approval, it happens a lot more on the medical side of the services that I generally see. When our behavioral health and treatment centers also have like a primary care clinic attached to it. But if they need to approve a lab result or they need to approve a document that came in that was uploaded, under My Documents, okay, if you attach a new document, so I'm just going to quickly go in and attach a document. So I'll hit the Add Document button at the top right. And what it does is it allows you to attach a document, and just like routing a signature, we're also routing a document for approval. So let's just say the patient is, I think I have to use test. I think we got rid of everybody that isn't test. And let's just say it's a lab test and urine screen results. Okay. And you can pick your categories. We did all these from yours, so I think these are all yours from what I understand. So I'll just pick anything. You can attach whatever document you're uploading, so that automatically goes to your provider or to the pending approval provider. So if you go in and you say, I just want to attach whoever, I might not be in this one. Normally we take it out. Oh, good, I am. And we'll say the document date, we got it today. If you click the button, now I'll just pull in any document, doesn't matter. But what happens is when I attach the document and hit save, it routes it to this provider. So in that same inbox, I'm going to send all pending signatures, and I'm going to send all pending documents to approve. So they're all filtering to the same spot. The only difference is pending signatures is under the pending signatures box. Pending documents is under the pending documents. Some of our clients don't really use the approval process where I have to route and attach to a provider to approve a document. Other clients live by it, so I just want to make sure I cover it. So I'm just going to hit save for now. You'll see that this patient is waiting for approval from Dr. 7. Here's the document, here's the category, and then I just kept it priority normal. So now if I go back to my inbox again, okay, and this time I go to my documents, you'll see I have this document sitting here, 10/1/20. So they're all routing to the same inbox, but those are the two types of movement of patients and data that generally are pretty important that everybody knows. Did I answer those questions? Are you good on that? Okay. John, are you still there?
Yeah, I am.
Okay. All right, so because some might have to leave, I'm just going to keep the floor open. Other things I can show you, but I would show you where some reports are and things. What else are you thinking I don't know how to do, or I'm concerned that it doesn't do it, or anything like that, or you just want me to show you from the supervisor level?
Even if you guys have had the thought, it would be nice if I could. At least asking would let you know if it's there or not.
Jim?
Yeah.
Would you just for the sake of seeing it again, will you go through unsigning a signed document from a supervisory role, please?
Yeah. So that we have to set, so the way we currently are doing it with 90% of our clients, I think do you currently unsign your encounters on your own, John or Mark?
Yes, I believe we do. Anyone fact checking
Okay.
on that?
Yes.
Yeah, the way we do it in cloud is we have a support person from 8 a.m. to 6 p.m. that all he does is unsign encounters. And the reason that we generally do that is we don't want a disgruntled employee to come in and unsign and delete 50,000 encounters on his last day of work. So most of our clients, if something needs to be unsigned or something needs to be deleted, you generally just send an email. We have a live person there that does them real time. If you guys have control, because none of our other clients do, I think Manny said that he would set you up with that, John, because normally we don't give that control out to clients. So if it's okay, can I come back to that one and let Manny work with you on that, John? Just because that's not a standard process in cloud anymore, but if you already do it in version 7, I know we're giving you all the functions you have from your current version, but it's not the way our other clients do it. So can I hold off on that one, and I'll send you a screenshot on unsigning, just because we don't currently have it set up to allow the client on their self to unlock, delete, or unsign an encounter.
Yes, that makes
sense. Can I
sense.
just come back to that one? Now, that being said, just to be clear, if you do that already, I'm sure we're going to allow you to do it now. In your new version, we just don't allow other clients currently to do that.
Bill, Susan, or does Bill, would you prefer to continue like we have it, or would you rather pass it off to ADS and get that daily response?
It would be extremely beneficial to be able to continue unsigning if needed on our end.
All right, then yeah, let's, we'll touch base afterwards, Jim.
Yep. Yeah, so the way just so you know, when Manny reaches out to you, so when we go into patient programs, and maybe I'll have Alex reach out to you. So let's just start with our client. And let me just sign a note quick. So what's something we have in here? Let's just do a DAP note. What it does is it takes about 2 seconds, it updates it, it signs it, it adds it to the timeline. So as soon as you sign the encounter, it refreshes your timeline for you. Over on the right is a button here, just so you know how to do it, is the unsign button. Okay, so when you select that, this is where it's going to be and the reason you're unsigning. So it's a very easy process. I didn't realize, I haven't worked with version 7 with you guys for a long time. We've kind of gone away from the unsigned, but just so you know where it is, so you don't need to be trained on it. All you do is you open up your signed note, open up the right-hand side, and you're going to click the unsigned button. Just tell me that you can see that.
Yes, we can see it.
Yeah.
Now, if you're there's a couple things that you can do. So to unsign an encounter, you have to be in the encounter. So, and what I mean by that, just to see how you would navigate to it, if I'm the person who needs to sign it or to unlock it for a counselor, but they don't have control to do that, you would go to patient programs, search for your client, Z. Patrick, go into his chart by clicking the little bottom link. Go to all your DAP notes, right, because this is just a bucket, because these DAP notes are going to happen over and over, or any type of progress note, whichever one you're using, or any type of note that you're doing. You'll have a whole list of 50. You just pick the one that you want, okay, this one's signed. Right-hand side it, unsign encounter. Make sense?
Yes, thank you.
You're welcome. And those are the exact questions that we want. So you'll see now when it refreshes, do you see how that note is unsigned? It's still the same note. Here's where I put test. Here's where I put family session. Here were the first couple check boxes that I did. So it converted it from signed to, from signed to unsigned. What else?
Could you go over some of the, could you go over some of the reporting features on like notes completed versus not, or just that whole area?
Sure. I'll have to look because I think we loaded we did a lot of custom reports for you, so I don't know your reports as well as I know our other clients' reports, but let's just look at how we get to them. The one other thing I do want to show is at the top right up here is something new. If you click the button at the top and you're in a chart, there's a recently viewed patients. So if I want to see just everybody I did today, you can see the last 20 clients' charts that you were in. It also has a new feature under the user dashboard, which will show you your treatment plans completed. It will show you anything outstanding. So the treatment plan button, this little window here, this little box, this will show any treatment plans that are about to expire within 10 days. So if you're using the time frame, the next review date in the treatment plan, once there's 10 days left till the treatment plan needs to be reviewed or it's going to be outside of protocol, they'll all start falling into here for each one of your staff. So you'll be able to see, oh, I have 14 treatment plans due tomorrow. I have 3 that are overdue. So this is at the staff level, at the login level, but they're all going to have a little alert system in here for the treatment plan. And basically where that comes from, I'll imagine Mark has sure someone probably built a treatment plan for him. Let's go all. Treatment plan here. I'm just going to do a new one so you can see what drives that. And you guys use the open treatment plan builder. So I'm going to go to there. Okay, I'm just going to hit add a problem. Okay. So where that comes from, when you build your treatment plans or you tell your staff to build their treatment plans, there's a little edit button right here. And this little edit button, you'll see a next review date. So what this does is it generally is set up to always default 30 days, but the treatment plan protocols from the supervisor level to make sure you're doing what the facility asks the staff to do, this is generally pretty important. So the next review date defaults to 30. You can go in and change it. So if it's whatever, it depends on the level of care. The lower the level of care, the longer the time frame till the treatment plan protocol review is due. But you can come in and change it, okay? And this treatment plan review date, when you build your treatment plan, is going to drive what shows up in my dashboard. So if you want your team really to stay on top of all their treatment plans, we're going to ask them to always put in the treatment plan review date when they build the treatment plan, and it'll help people to stay more organized. Just a little tip. We see a lot of clients appreciate that in the new cloud. Any questions about that? Okay. All right, John, you wanted to go over some reports, right? And I assume you're just talking about your clinical, more of the clinical side, not Medics Premier Practice Management, right? Just clinical?
Yes, correct. And then maybe after that, if we have some extra time, we can do, like, if there's a task assignment or anything like that.
Okay. All reports are on the right-hand side. What you'll do is you'll scroll to the bottom. There's 2 sections of reports. There's standard reports, okay, and these include your dispensing logs, your missed dose reports for nurses, everything generally that's done like every day. What's my caseload by provider? How many active clients do I have? The client served report, dispensing logs, treatment plan reports, all those are standard. Everybody gets them. Anything that we built for you, because we do a lot of customizations on reports clinically, are going to be in the next section, which is something called custom report. So everybody wants a dispensing log report, but everybody wants it 19 different ways. So we end up having to customize reports for everybody. So generally for each client, they have their own bundle of reports that they like to run. So I'm going to assume, John, that's where they moved all of your current clinical reports into, if it's not one of the standard reports. So what I'm going to do is go to custom reports, click on predefined reports, and anything that we pulled over are sitting here. So your bed board discharge report, your program report, your active patients excluding remits, these definitely are yours because I don't have these in other clients' databases. So before we go into them, let me just make sure, again, everybody knows how to get there.
Susan is, we're working on a plan there. I never heard the plan, so.
So when you log into the system, I did it from a client's chart. You do not need to be in a client's chart to navigate the right-hand side. This right-hand navigation bar will change depending on where you are in the system.
We have
so for example, let me see if I can mute her.
Mm-hmm.
Shoot, I think it might be 2 users I can't mute. Okay. When you log in, the right-hand side is different here. I think it was Bill or someone had asked about unsigning. You'll see that on the right-hand side, none of those unsigned options are there. Why? Because I'm not in a signed encounter, so why would I present that? So the right side navigation bar changes depending on where you are in the system, what you can do on the right-hand side. So the custom reports would be where yours are. Yours are your predefined reports. And I don't know what's in each one of your reports. I haven't looked at them in years. But I'll just do active patients excluding readmit.
Okay.
Okay? So what it does is it generates your list. So all of your daily reports, I am going to assume, have all been loaded, John, into your predefined reports, which is a bucket of client-specific daily and weekly reports that you run.
All right.
Any questions about that? Okay. If I want to run my dispensing reports or something related to a nurse, I would go to reports. Let's go to my missed dose report. Here's everybody from a date. This is just for today that has missed their dose. So here's your list. So all the reports are right-hand side driven. I don't know which for the staff members are on which ones they run, but you have our standard reports, and then you have your custom reports that are in predefined reports. Okay. John, is that deep enough for today? Do you want me to expand on any of that?
No, I think that's good enough for now.
Okay. Just remember reports bottom right-hand side. Okay. And I think, like my encounters, you said it works almost the same. A lot of the things on the left and right-hand navigation bar really work exactly the same that you currently use. The more important thing is navigating, navigating to find it, where is it different? And number two is what's new. So the user dashboard and the recently viewed patients and some of that stuff and the timeline, that's all new and really helpful. And then being able to find your reports is helpful. So if we go to tasks, a couple ways you can do a task. On the left-hand side, there's a button for tasks. You also, most of the stuff which isn't one of my favorite designs of the application. Generally, I tell people you have this whole bundle of stuff in here. I think we should just collapse it. But the inbox basically has everything, okay? It has your sent tasks, your pending tasks, your episodes, my documents that have been forwarded me that I have to sign, my pending signatures, what I've completed for the day. It's all under one icon called Inbox, but you also can get to some of those because they have their own little button for like a little quick link, so you don't have to hit the inbox, come in here, go to tasks, find your tasks. There are some shortcuts that you can do just by clicking them. That's why they're there. But the task box is very simple. The inbox to send an email and the task are very, very similar. The key is, and the one thing that I see people miss is a lot of times clients on day 1, day 2, day 3, they go to send a task and they don't know how to send an email, or they can't figure out where the button is to actually start a new task. I have found for some reason it's not as obvious as I may think it is. The create task is the little button up here. Like I get a lot of calls the first week. If I go to inbox and I go to email, for example, okay, there's a little button up here that says compose now. A lot of people look for it on the right-hand side of the screen, whether you're doing a task or an inbox. I think we're just programmed to do that from Outlook or whatever. But just remember that the action function in whichever one that you're in here for compose now, create a task, whatever it might be, it's the little blue bar at the top. I get a lot of calls that people say, I can't find how do you start new mail. Just remember that. So I'm going to go to tasks. I'm going to create a new task. It looks exactly like the email, and I'll send it to myself. Okay. So the date range is when do you want it, when are you starting it, and when is it supposed to be done. So we'll just pick today and then apply today. Okay, so if you want to say there's 3 days that you have to get it done, but you have to do this by Thursday, you can do that as well. And then we can hit the send button. Okay. And all it did was, if you just look, it immediately sent me a task. So now me as the provider, I can see the client's having stomach pains. It was sent by Henry 7 to Henry 7. Here's the message. And then I can decide what do I want to do. So up at the top, I can edit it. At the top, I can close it. At the top, I can forward it if it needs to go to someone else. So the task is very much just like email, except it doesn't fall in the email bucket. Is that what you meant by a task, John?
Yes, and is there a way for our supervisors to track the tasks that they've assigned?
So you want to track tasks for all licensed staff that are sending them in their department, for example, right?
Yes.
Yeah. So you want to bundle all tasks like you do My Encounters and be able to see it? I want to see all open tasks for these 6 providers or 6 staff. I want to see all open tasks for 5 or 6 of my staff and see what's not been completed. Is that what you're asking?
Yes, that's correct.
Okay. I do not know that answer. Can I get back to you on that?
Sure.
I know the task is a user function.
All right. Well, I have nothing else I can think of. Does anyone else have any questions for Jim?